I have always thought the general practice was very well set up to help people with weight problems, and the reason why I think that is that we've already got the relationship with people and they trust you. The weight loss program, I actually developed it several years ago, the original version of the program. It's probably going to be more enduring this time because it's not really just based on one person, which was me, trying to keep it going. It's more that the whole practice has taken it on. The three general practice nurses that we have now are all involved in the program, and they all have their own patients, so they see them on a regular basis. They've actually been given the time and the opportunity to develop their own confidence and knowledge.
We'd bring them in weekly, we'd discuss, how they're going, we'd look at their food diaries, if they've had any slip-ups, were they having any problems.
Most patients found that weekly visits were beneficial. We did have to work with some patients and we'd do phone calls, or fortnightly visits would be better suited for them.
Another key feature of the program now is that we've expanded it to include allied health professionals.
So we use the dietitian, we also use the exercise physiologist. A lot of these people hadn't exercised before, so it was good to get them involved with that. So not saying get out there and start exercising, they may have had injuries, not very strength, just to build up a basic before they went out and hurt themselves as well, doing just general exercise.
We got feedback from our dietitian in case conferences that we held, so we could see how all patients were going and how they were tracking. With the physios, they'd send us letters just to tell us what they'd inform the patient to do, so we could all be on the same page. We identified using the PenCat search that there was 50 to 70% of our patients considered obese, morbidly obese or overweight. You build a great rapport with the patient and they continue to come back, you see great results, and it helps them maintain what they've just achieved instead of bouncing back and putting all that weight back on again.
You build up a rapport and a friendship with them. They're happy to, blurt out the mistakes they've made and things like that. So we try to always keep it with the same nurse.
So the support of the staff, and they're all very open and friendly, and accountability is very good. Yeah, that was the one other big sort of motivation. I commenced it last year in July because my cholesterol was rising, and not just one level, all the levels, and my GP was thinking about putting me on medication, and once I heard that, I thought, no, I've got to really now be serious about doing something for my weight.
We saw big reductions in cholesterol, blood pressure, their increased exercise that they were able to do, and just their general well-being. So seeing them happy and really getting a sense of achievement out of what they'd done.
I've had the cholesterol checked twice and it's within the normal range, and that was my biggest success. I was so thrilled about that. But I really do feel really well, and I've had to spend money on new wardrobe, really. Nothing fits.
I think it's been a great initiative for our practice. We've got lots of benefits out of it, patients, for the staff, for the morale of the staff. The first thing we needed to do was to understand our practice population, make sure that everyone knew their roles and responsibilities within the program. We needed to decide what model of care was going to suit both the patient and for the practice to make it sustainable over time. We needed to start the program with some resources. We needed to be able to provide staff training and then ongoing review. The initial visit the patient paid for because it was a little bit of a conference about, is this going to be worthwhile? Are you keen to do it? Then the first doctor visit was developing the care plan. And then we were able to utilise the nurse visits, which is 5 under a care plan for the first 5 weeks. And then the monthly visits with the doctor. The patient would pay a reduced fee. We're not a bulk billing practice, so patients are used to having to pay, so that no one balked at it. And then the 3 monthly visits was a review of the care plan, which again was a no out-of-pocket expense for the patient.
I think it's really good to have something to offer people. It's one thing to say, oh, you need to lose weight, you need to stop smoking, you need to stop drinking. But if you actually haven't got something to offer them, then you're missing a lot of opportunities.
So it's about education, and it's about monitoring, it's about support, it's about checking in, and it's about having to make multiple changes to your lifestyle to manage it. So you do need to increase your exercise, you do need to watch your diet, and you do need to monitor.
I think it's very good for our practice to have a program to say, look, we've got this program where we're showing that we're confident that we can help them. It lends itself to any chronic illness, really.
I'm very, very pleased, yeah, and I feel really great, yeah. I'd recommend it to everyone.